Hi, this is Dr. Taylor, and today I'd like to talk to you about hip pain. Hip pain is a pretty common condition we see in our office. It's usually right in this area, this joint called the femoral acetabular joint. But it could also be coming from another joint, the sacroiliac joint. It could be a referral from the lumbosacral joint here, or a disc that's putting pressure on the nerve, referring pain to the hip. It could even be caused by a lower extremity joint being out of alignment, especially this femur bone can be moved anterior or posterior. So let's say you got everything ruled out. You're not having any issues here with the osseous. It could be caused by scar tissue in the surrounding muscles of the hip. So scar tissue is when your muscle fibers tear and it repairs itself. So here's your muscle, looks like this. And when you have scar tissue, you have an injury, a trauma, and those fibers will separate. These are little micro tears that occur inside the muscle. And when that happens, your body sends blood to the area and sends little fibroblasts, which kind of repair that area. Looks like this. That's why it'll send blood and you'll have inflammation. That'll cause pain. But what'll happen is that that muscle then will be shortened because you have this scar tissue that is developed to repair it, and this is often a source and cause of a lot of people's pain and problems. I'm here with Marco Antonio Franco. You won the 50 meter. Oh no, you came second place in the world for the 50 meter dash. Yeah. And in the age category from 45 to 49.
Yes.
45 to 49. Second place in the world. Now he comes to me with the pain in the hip. Where's the pain?
Here is right here.
Okay. And what kind of pain is that? Sharp pain?
Yes.
We just did a little treatment, so it feels a little bit better. But where's the pain? You stand up, bring the leg up. Yeah.
The pain is right here.
Okay. Bring the leg. Any
Here?
pain with that?
No, I feel the pain when I go down.
Okay, do that when
Yes,
you
because
felt that when you go down.
Yeah, when I go
Okay.
down, I feel.
All right, so we're going to do a treatment on this here. How's that feel when we do that?
I feel good. Yeah.
Feel pretty good?
Yes.
Okay.
Because I feel tight,
Very tight in there. Yeah. So he's got his muscle here, this pain here that he's feeling in the hip is actually coming from a different area. It's coming from over here in the vastus lateralis. So you can feel where those adhesions are, and then we're just kind of separating those fibers. Bring it down fast. How'd that feel in there? Any change with that?
Yes.
Do you still feel pain in there?
No, right now.
That's already feeling a little better. What percent better did that feel just by doing that? What percent better did it feel?
About the 40% better.
40% better?
Yes.
Okay. No pain when you go down now?
No.
Okay, how about when you go up?
I feel.
When he was having pain when he brought his leg down, and that was actually coming from the vastus lateralis and a little bit of the upper TFL. But when he goes up, the pain is actually coming from the inner vastus medialis muscle, inner quad muscle. So we need to clear that out in order to improve that. So sometimes adhesions will be associated with specific muscles, and that if you can clear that adhesion out, it'll clear that pain out with that particular action. So line your back for me. That would be better for this kind of fix. This is a very sensitive muscle to work on here, so we're using a little bit more gentle approach, using the rapid release. Good. Okay, come on up. How is it when you come up?
Yeah, better.
Better? Any
Yeah.
pain in there?
No.
So sometimes you have these injuries here. You're just having pain here in that hip. If you can nip it in the bud early and take care of the adhesion, you can save yourself a lot of problems and headaches later on by taking care of it and addressing it early on. What I like to do, what you can do yourself at home, is grab a tennis ball and let that tennis ball dig into that area of the quad and just let it roll. So you can lay down on a bed or on the floor and just let that kind of dig in there, you find a good spot, like there's a spot right there, you can just kind of move around and kind of clear that out. You can also do it on a wall if you like to, letting it dig in here. So that's a great relief. You'll find that spot by doing that. You're kind of taking pressure off of that scar tissue and helping it to break up some of that tightness. That should elongate some. Now, you can also, after you break up the scar tissue, you want to stretch it out. So what you can do, you can stretch it out like this on a bed and just kind of stretch out wherever you've worked. You can hit the different angles, whether you worked on the inner quad or the outer, and you can do that. You can also do it on the floor like this and stretch it out. Either way, if you have back issues or hip, just by stretching out these muscles in the front, a lot of times it can bring relief to this area. So I hope that video has been helpful, and this is Dr. Taylor signing off.